and the College of the North Atlantic campuses are situated throughout the province of Newfoundland and Labrador. Since we are joining together virtually today, I would imagine that many of you are dispersed throughout our beautiful province. At the Center for Nursing Studies and the College of the North Atlantic, we respectively acknowledge the land on which we live, work, and play as the ancestral homelands of the Beothuk, whose culture has been lost forever and can never be recovered. We also acknowledge the land of the Ukdamguk as the unceded traditional territory of the Beothuk and the Mi'kmaq, and we acknowledge Labrador as the ancestral homelands of the Innu and Inuit. We recognize all First Persons who were here before us, those who live with us now, and the 7 generations to come. As First Peoples have done since the beginning, we strive to be responsible stewards of the land and to respect the cultures, ceremonies, and traditions of all who call it home. As we open our hearts and minds to the past, we commit ourselves to working in a spirit of truth and reconciliation. My sharing of this land acknowledgement reminds me that I am accountable to my relationship with the land with Indigenous communities, and that I am responsible for learning about colonialism, my own influence as a settler, and its impact on Indigenous peoples. Next, I would like for you to be able to click on our QRL code, and I'd like for you to put in there what helps you be an amazing nurse. So what are your traits that makes you awesome? I'll give you a few seconds, and then Cheryl is gonna highlight some of the comments that you guys have put in your post. Can everybody get into the QRL code?
Starting to see some words populating here, so it shouldn't be too long. Just scan the QR code with your phone, with your camera, if you're not used to doing this before, and then it'll give you a couple of different screens that'll pop up throughout the presentation. So hopefully you'll go on this journey with us and help us learn from you folks just as much as what we're hoping to share with you.
Definitely, it's a learning for all of us as we do these things.
I don't know. She got her on her phone. Oh, did she?
Yeah, did yeah.
Yeah.
I'm just going to ask everybody to make sure that they're muted. I'm trying to mute people as they come in, but just be cognizant that we can hear what you're saying. Thanks.
So some of the words that so far have popped up, again, as you're entering your own words, you'll probably be able to see the ones that have been entered previous to you. So some of the words that are coming up, we've got compassionate, collaboration, honesty, trust, empathy, professionalism, patient. So those are all fabulous words, absolutely, to describe nurses, and glad that you're recognizing those traits within yourself. That's amazing.
So thank you for sharing, like Cheryl said, these attributes. And it's really important to note, not only do these positive attributes impact and improve our healthcare system and the care that you provide to patients, but they're also the qualities that will make you great preceptors. So our agenda today for our presentation, we're going to be linking preceptorship to the standards of practice. Then we're going to provide an overview of the practical nursing program. We're going to look at what preceptorship is, what a preceptor is. Then we're going to look at what are the benefits for both the student and the preceptor. And then we're going to look at some of the resources that are available to facilitate preceptors to be successful in that role. And then Cheryl is going to come and speak after me, and she's going to look at the communication, so the evaluative component. How we effectively communicate, learning, and things like that. We're going to end with a wrap up, so that will be an opportunity to ask questions. So we're going to begin by looking at the standards of practice for licensed practical nurses in Canada in 2020. The two standards that we're going to look at today is Standard 1 and Standard 4. Both of these standards highlight the responsibility of nurses to take on the role of being a preceptor. So Standard 1, professional accountability and responsibility. LPNs are accountable and responsible for their practice and conduct to meet the standards of the profession and legislative requirements. Within that standard, we look at 1.10, and it states provide leadership to support and or participate in mentoring and preceptorship. Next, we look at Standard 4, and Standard 4 highlights that nurses must maintain a professional and ethical practice, which includes demonstrating effective, respectful, and collaborative interpersonal communication to promote and contribute to a positive practice culture. That we must demonstrate practice that upholds the integrity of the profession, and we must demonstrate characteristics and attributes of a leader and the ability to apply formal and informal leadership competence. Now we're going to look at an overview of the PN curriculum. So the PN curriculum is a five-semester program. We have 496 hours of theory and simulation, 136 hours of lab, and 992 hours of clinical. Included with that is the 280 hours that would be considered part of preceptorship. So the Center for Nursing Studies has developed PN curriculum, and this curriculum is delivered at the Center for Nursing Studies and throughout the province at the College of the North Atlantic, and is currently offered at 9 sites through the College of the North Atlantic. The CLPNL is responsible for ensuring that the PN program meets specific educational standards. All entry-level practice skills are taught in the PN program. Students receive the knowledge as their foundation and then practice in the lab and clinical setting to further enhance material that is learned in class. Not all skills get to be practiced in the clinical setting with their clinical instructor, so students may come to preceptorship with a list of skills that they want to achieve and obtain competency in. For example, all students may not have an opportunity to do catheterization or IM injections. I know a number of students that I had in preceptorship last year, they didn't have an opportunity to do an IM injection. I know when I graduated, we certainly gave lots of IM injections, but that was something that a lot of students didn't have, access to. There wasn't, as many to do on the unit. So they were really excited to be able to do that skill. So we look at the PM curriculum overview. So students engage in classroom activities, gain experience in the lab, and practice in the clinical setting. So with regards to our lab and our clinical setting, they certainly take the knowledge that they've gained in the classroom and they apply it in lab and clinical. So they get experience in med-surg, maternity, pediatrics, and health, and certainly palliative care. So they practice and provide care across the continuum. So that's really important to know that they've had those experiences. So when we look at preceptorship, preceptorship is certainly a way of using role modeling to support the learning and professional growth of students. And it's so important. Your role as a preceptor cannot be matched by anything. I notice that the students grow so much when they're in the care of you during preceptorship. They obtained 712 clinical hours with instructors prior to preceptorship, and right before coming to you in preceptorship, they do 4 weeks of consolidated practice. So that's, instructor led, but it's 4 weeks of consolidated. So they're there 3 days a week. They usually do 3 12-hour shifts, or in some places it may be 4 10-hour shifts. It just depends. During that time, they're focused on gain more, consistency, more strength in developing their health assessment skills, becoming more proficient with medication administration. So they do develop competency in some skills, but for some students, they may have only had the opportunity to do a skill once. So they're certainly not proficient. And so we kind of have to take that into consideration. So as I said a second ago, preceptorship is 280-hour clinical hours, and it's completed at the end of the 5th semester. So what is preceptorship? So preceptor, or what is a preceptor? A preceptor is an experienced practitioner who provides support and learning experiences to students. A preceptor will work with the student for a predetermined period of time to assist them in attaining competencies required safe, ethical, and quality practice. So in order to be a preceptor, and these things are so important, you have to have at least 2 years of current practice experience and in the area that you're currently working. So that's really important, because you need to be able to be familiar with your environment, so that you can support the learning of our students. It is best if you practice to the full scope of practice, or so that the student can be supported by other LPNs that are working to their full scope of practice. So I know that there are times when you may not have the skill in order to be able to do, say, IV medications. So if you don't have that skill, like it's not within your current skill set, and there's another licensed practical nurse who's on the floor and they can do that skill, then you can, in collaboration, with that other LPN, have the student complete it. To be a preceptor, you must also maintain a current registration license with the CLPNL, and you have to demonstrate performance that reflects commitment to professional growth. And that goes right back to our standards, especially standard 4. Next, I'm going to get Cheryl to talk about the competency learning cycle.
Thanks, Charlene. So when you see students, coming into, or when we receive students coming into the practical nursing program as brand new students, they're starting out at the beginning as a beginning learner, and they're not really sure what they know at this point. A lot of students don't have, they might not have had the benefit of having another family member or somebody that they know work as a licensed practical nurse. So sometimes, they're not really sure about the scope or the different skills that they'll be performing. As the students move through their program, they become more conscious of, those skills. So when you get a student in preceptorship, they're either, they're leaning towards this third dot here on the screen. So they're more, they've got a lot of knowledge, they've got a lot of practice, they've been, through several clinical courses with their instructor, and they certainly know, they should know what they know, and they absolutely should know what they don't know at this point. So that's where you come in then as the preceptor and help them reach the learning goals that they need. So, ask them what they're what they have left that they need to learn or become proficient in. And then certainly your role as a preceptor, after having at least a couple of years as a licensed practical nurse, you would be, conscious of, things are within your scope, and very proficient in the skills and your scope of practice. And you're making, right decisions and critical thinking decisions and things like that. So, students are going to be looking to you for you to share your information. And as Charlene just mentioned with the previous slide, it's okay if, if there's certain things that you're not, comfortable with. All of us have been educators in practical nursing. And, there's things that when I had students out on the unit, I wasn't completely familiar with, if there was a new, medication or a new procedure that was happening. So again, we'd lean on our colleagues that were working on the floor alongside of us, the folks that were, are there in permanent positions, and say, can the students come along with you as an example, and can you help, help them with this new learning. So again, it's a big circle of care when it involves training students. So lots of work for everybody to do.
Thank you, Cheryl. And I have to reiterate what Cheryl said. I picked the IV example because if I had to give IV meds or insert an IV, that would be certainly something I would have to seek assistance, because I'm a gerontological nurse. So what are the qualities of a good preceptor? So once again, if you can click on with your phone on our QRL code, that would be great. So the questions we're looking at: what do you remember most about them? How did they help you learn?
So I've just advanced it to the next slide in our Mentimeter. So hopefully you're able to see that, new slide, and from the same QR code. So just wait and see if we're able to include some notes there. please do come off mute and let us know if it's not working or type something in the chat. Oh, I see a response already popping up here.
Yeah, we can see it, Cheryl, so they should be able to scan it.
All right. So the question again, what do you remember most about your favorite teacher? So I'm seeing that they were kind and patient. Another one that says kindness and the ability to remain relevant. Remember the instructors that were patient and kind, and seeing every instant as a learning opportunity. Yeah, that's fabulous. So again, seeking out those learning opportunities, assertive and professional. All right, if you feel free to continue to populate some of those answers. Got another one there now, good practice knowledge. I'm going to move on to the next slide though in the Menti, because we do have, I believe there's a second, the second question is populated as well. Do you want to, so how did they help you learn? That's the next question. You want to answer that one as well? So again, what type of teaching techniques might they have learned or taught you? Not to lead you, but did they ask you lots of questions? Did they, show you videos? What kinds of, how did they help you learn? So I see they were patient. They talked about real life scenarios. Yeah, that's really helpful and really get students going with their critical thinking skills, because sometimes you might not, all the opportunities for learning might not present themselves, but through questions and talking about real life scenarios and asking them what they might do in that situation, those are certainly great ways. Letting us practice under their supervision is another one, by doing and giving opportunities for practice.
Excellent.
Thank you so much. Those are great. So again, anyone else that wants to keep adding things, they certainly can. But I'll go ahead and advance to the next slide there now.
Thank you. And I would have to agree with some of the qualities that you have said. For me personally, it's always been about, I remember the person, like not the person, but how they treated me. I guess I'm not really great with names sometimes. I'm always remembered if it was a supportive environment. So I think that's one of the key things, is to create a supportive environment, an environment too, and Cheryl's certainly going to talk about that, creating an environment where you can provide constructive feedback and assist the student. So
Cheryl, just before you go on, I just want to tell you there's a bunch of comments in the chat, and some of the things that they're saying is understanding the needs of the student nurses, attentive to things around them, good communication skills, understanding, hands-on practice, and reviewing policies before completing the skill and watching them first on practice.
Excellent, excellent, excellent. Especially about the policies. Yeah, that is so important. Thank you for all those comments. So next we're going to look at the qualities and attributes of a preceptor. So as we go through these attributes, think of which ones apply to you. So a preceptor should demonstrate a clear understanding of the CLPNL standards of practice and is able to demonstrate these abilities. You are able to set goals and assess other nurses' competencies and your own, and as that of the student, can facilitate problem solving as situations arise in the clinical setting. They have strong active listening skills, demonstrate understanding and reflective practice. It's really important as nurses that we learn to reflect and reflect on the things that we do really great. And I think that we miss that sometimes. I really do. But we also need to reflect sometimes on the things that we may be able to improve on. An example may be if you're doing problem solving, it becomes second nature when we do tasks, that we understand, okay, I need to do X, Y, and Z. And it's, to the students, it's amazing. How are they doing that? But sometimes we don't explain what we're doing, how we're problem solving. So if we self-reflect on that and we say, okay, maybe if I taught the student how I'm, step by step, how I'm problem solving this issue, I can improve their learning. So it's a part of self-reflection. But I can't emphasize enough, we really need to be positive about the positive things that we're doing. So self-reflection can't just be, how can I improve? It also has to lift us up. You also have to demonstrate good time management and leadership skills, demonstrate appropriate clinical decision making, and use evidence-based practice. And continuing on with quality attributes of a preceptor, recognize your own limitations and the limitations of other disciplines and individuals. Know what resources are available and how to refer to those supports. They are effective and inspirational role models and demonstrate professional values, attitudes, and behavior. You are able to prioritize care and always aim to provide a high standard of care to your client or patient or resident. They can give non-judgmental, constructive feedback aimed at supporting a student's career growth. Is open, or you are open to a variety of learning styles to facilitate student learning. Thank you, Cheryl. So the next thing, we're going to ask you to do another QRL code. And I just want you to take a moment. I want you to reflect, like, what would your superpower be as a preceptor? What do you think that would be? Any comments coming in, Cheryl?
No, nothing there yet on the Menti. Oh, I got one there showing up now, experience, but feel free to use the chat as well, folks.
We got experience and encouragement in the chat.
I would like to say life experience, and I'm a talker. So I love precepting nurses that are just coming in. And yeah, by being very open with them, I find I get a very far away with people with that. So.
Absolutely.
That's fantastic. That's great. I think we all have superpowers that'll make us great preceptors. I really do. I see when the students are with preceptors, they grow so much, and they grow and expand in their, in their career as, as a beginning novice licensed practical nurse. So when they're making that bridge, when you're there with that student, it's just simply amazing. Like when I watch the growth that they have over that 7 weeks.
Yeah, and I've got another one there now. It says active listening and emphasis on safety. Absolutely. And there's so many tips and tricks that you've, learned. Like I remember visiting a student one time that was on their preceptorship, and the LPN had taught them to, have like a hair tie or something on, and just loop it over from their wrist to their thumb, so that they remembered when they went in the room, they had to, check the pulse on the patient, because they knew their medications, needed to have the heart rate monitored, as an example. So just little tips like that in a busy, life and work environment, things like that are going to help make sure that you're providing safe, competent care to your patients is really important. So all those tips and tricks are very helpful. I'm just going to move on there now.
Thank you, Cheryl, for that great example. Did we do that one already, I think?
Nope, this one, I got benefits of becoming a preceptor is up on the screen there now.
Okay, thank you.
If that's matched.
So being a preceptor is certainly a rewarding role. It gives you the opportunity to contribute to the professional growth of a practical nursing student. It enhances your professional status and personal growth. It has been known to increase job satisfaction. Preceptors also increase their own learning and have found they get motivation with new ideas. And I think that's really important to note, that the knowledge sharing is not just linear. It's not just occurring with the knowledge going from the preceptor to the student. The student is often bringing back new knowledge, bringing back new ideas, bringing back some recent research that they have learned about, and they kind of bring about this excitement on the floor because they're anxious to learn, they're anxious to participate. It also increases your leadership skills, and you will be happy to know that you can earn up to 7 hours of continuing competency program hours by being a preceptor. So the role of a student in preceptorship. So it's important that we also know what the role of the student is, so we can, set goals right from the beginning. So as a student, the student is expected, just like a preceptor would be expected, to attend an orientation session. They have to provide safe and ethical, compassionate, and competent care. They have to seek out opportunities for clinical and professional development. And that's something I strongly encourage and emphasize, that students need to be always ear to the ground, trying to figure out if there's learning opportunities, whether there's a lunch and learn that they may be able to attend, if they have their work completed, maybe the wound care specialist is on the floor, maybe there's something that they can go and watch. They have to practice competencies within the scope of practice determined by the CLPNNL and the workplace policies. They have to maintain a positive professional attitude and image, and they have to demonstrate fitness to practice. And that comes back to the self-reflective piece. And that's something that they have to do daily, is that they have to assess their fitness to practice. They have to be able to accept guidance, supervision, and teaching offered by the preceptor and preceptorship course leader and clinical faculty. They certainly have to notify their preceptor and their clinical faculty of absenteeism or any changes in their schedule. They must demonstrate accountability and responsibility in communicating with faculty on a frequent and timely basis, including contacting faculty immediately in the case of a medication error or a clinical incident. And once again, that's the student's responsibility. Certainly in collaboration, they will do that, but the student has that responsibility. So the continued benefits to the students, or the benefits to the students, is that it helps to bridge the gap between theory and entry to practice. And when I speak to students after they've graduated and I see them on the floor when I'm out with other students, they really emphasize that preceptorship has allowed them to get their footing once they graduated. They feel more confident in that role. So they gain confidence and independence with progressive responsibility. They have growth in professional self-image and career affirmation. They have increased awareness of legal and professional obligations. And that goes back to some of the things that people were mentioning about checking for policy and those types of things. And they have less stress as they move from the role of student nurse to that of licensed practical nurse. So some of the main concerns that I have seen over the years, and rightly so, because we would all have these questions: what if my student does something incorrectly or causes harm to a client? Am I responsible for that mistake? And I hear that a lot of the time. I guess the main thing is to know is that the student practical nurse is required to perform with the same degree of competency as is required of a licensed practical nurse, and is personally responsible for their own actions. Okay, so they have to work within the code of ethics. They have to work within the standards. They have to follow the policies of the institution of their school. So whether that's CNA, College of the North Atlantic, or here at the Center for Nursing Studies, they have to work within those parameters. So they're accountable for the things that they do. The only time that there's an exemption to that is if a licensed practical nurse delegates and does not oversee a skill for which they are not yet competent. So they ask a student, so if you were a preceptor and you asked a student to complete a task or a skill that they're not, able to do, it's outside of their scope of practice, then you would be considered accountable. So both you and the student would be accountable then, because the student should be able, excuse me, be able to recognize that that's something they shouldn't be doing, but it's also the role of the preceptor to identify that as well. So additional preceptor concerns. So these are some other questions that come up frequently. What if the student is not progressing the way you think they should be? What if the student has a personality that is very different compared to yours? And what if you're not sure how to give constructive feedback to the students? So these are all very valid questions. So it's really great that people can anticipate your concerns by, identifying potential concerns. You can define the necessary supports, and you can, determine what are the next steps. How can I ensure that I have the information I need? On our next slide, we're going to actually discuss some of the resources that are available to you. So some of the resources are certainly that you're going to attend an orientation session scheduled by the school, and that usually occurs right before preceptorship. Liaison frequently with the course instructor, such as before the students arrive and during preceptorship. Faculty will either on-site visit, or call at least once a week. And many times we are visiting or calling once a set of shifts. So we're readily available to you. You can consult with your manager, so talk about your interest in being a preceptor and any concerns you may have now or that you may foresee in happening in the future. You can ask your coworkers for assistance. So, and as nurses, we work as part of a team, and that team should help support you in your leadership journey. And I find that on the floor, if someone is a first-time preceptor, lots of times, the floor will embrace you and help you kind of figure out that role, especially if there are other students on that floor, or if there's other people who have been preceptors in the past. You can call a practice consultant at the CLPNNL, and you can enroll. So there's a great course, and Cheryl's going to talk to you about that. Enroll in the complete the Healthcare Professional Preceptor Training course, which is offered by the College of the North Atlantic. So you can enroll early in that program so that you have time to reflect on how best to be a preceptor. As well, I just don't have it here for resources. The other thing that's available to you, so I think some of you may have been preceptors in the past, here at the Center for Nursing Studies and the College of the North Atlantic, we have a preceptorship book, and I want to call it a book, that outlines what the role of the preceptor is, what the role of the student is. It highlights different strategies that you can use. It provides you with resources. So it's a really great resource, and it's something that I would encourage you as a preceptor to have at your ready, whether that's to have it online or to print it off. It's quite lengthy, but I have to say it really provides good guidance on how to proceed in your role as a preceptor within the practical nursing program. I'm now going to pass it over to Cheryl, who's going to continue on looking at the health professional preceptorship training module. Thank you, Cheryl.
All right. So at CNA, we do, and this is open to anybody in healthcare. Certainly, we offer this to various professions. And here on the screen, you'll just see the various modules. So modules 1 through 9, the different types of education that would be in each of those courses. So it is offered on Brightspace by D2L, and this course is offered free of charge. There is a test that you can take at the end in order to get a printed certificate, and you have to receive a pass mark of 70% on it. But again, it goes through so much information about, what, the roles of a preceptor, different adult learning theories, what it's like to have different generations of learners all, again, you're learning from students, they're learning from you. Some people are born in the 70s, 80s, 90s, 2000s. So what, what to expect, I guess, or things to think about as there's multiple different generations of learners in the same, environment. Again, teaching learning skills, how to foster that critical thinking, how to give feedback, how, different types of evaluation techniques, and then what to do if a student is struggling. If you recognize a student is struggling, we still want every single student to be successful, if at all possible. So therefore, there's lots of tools and techniques on things that the school can do, or the colleges, college and the Center for Nursing Studies can do, to help get that student back on track and help them be successful. And then also some information and learning on conflict resolution. So to register for this course, you can email amanda.kinsman@cna.nl.ca, or you can certainly get in contact with myself as well, and I can help connect you. This course doesn't have a set start date. It is at your own pace, so therefore, registration, lots of times Amanda will have a running list, I guess, of people that are interested in doing the course, and then 2 or 3 times a month she'll send that list off to our IT support staff, who will then register you in the course. Okay, so you'd have to keep track and keep an eye to your email, and just wait for that registration link to come through. So next we'll talk about some, things to consider, and I'll walk you through some helpful points as you're, receiving a student once they arrive to your unit, or there's a student there with a, with another preceptor. So picture a student arriving to the unit. They're certainly eager to learn. They might portray, confidence. Sometimes, people are unsure what they think of confidence, whether it's good or bad. Deep down, most of the students that arrive are, slightly nervous or very nervous as well. So try and put yourself back to those initial days of when you walked onto the unit for your preceptorship or your first job. I've been fortunate. I've changed jobs a few times in my career, and I always remember what it's like to be new in an area where you're trying to make sure that you do things right. So again, greeting them warmly, introducing them to other people on the units. Absolutely, everybody on a unit matters and helps the healthcare system run. So and introduce them to your colleagues, introduce them to clinical educators, the managers, the housekeeping staff, dietary, everybody that you can find to introduce them as they go through their preceptorship. Ensuring, that they have the tools to be successful for the first day and the continued days starts with an orientation, usually to the unit or the building, including a fire safety orientation. So they might never have been on your unit or in your building before. So do keep track of those things. Also invite them, to coffee and lunch, or if you're not somebody that normally goes to the break room, maybe ask a colleague to take them with you and, take them under their wing for breaks and things like that. Sometimes they might not accept on the first day, but, maybe wait a couple of shifts, and after they've built a rapport with you, maybe they're more comfortable to join the group in the break room and things like that. Students entering into clinical settings are definitely looking for employment. So they're going to navigate towards an environment that is welcoming, compassionate, accepting, and demonstrates a collaborative approach. And I'm sure we can all relate to this communication example here. So again, can't emphasize how much communication is the key to success, and will certainly help make sure that students have a positive experience, and that you see the outcomes of what you're asking. If you're asking them in a language that the student is speaking, you will see the outcomes are exactly what you want them to be. So as students arrive, I'm just going to get you to think about, what type of learner are they, or what assess their learning needs, just to get a better understanding. So that begins with a conversation to understand the student, where they've been previously for their clinical courses, what kind of confidence level they have, and what kind of specific goals they have for this rotation. As Charlene mentioned earlier, maybe they haven't had a lot of IM injections, as an example. Maybe they've never cared for a palliative client before. So again, thinking back to what you know as entry-level competencies, find out what the student is actually looking to learn, and make sure that, if those opportunities arise, you're able to look for those opportunities for the student. Also by recognizing if in some situations the student might be, a combination of novice, intermediate, or advanced. So in some situations, the student might be, very novice. They might never have done this. They've only learned it or looked at, pictures or videos of completing a specific skill. So they might be nervous and worried about making mistakes. So therefore, it's your role as a preceptor to offer clear instructions and close supervision in those situations. Again, you can do this by step-by-step guidance, demonstrating the task first and asking them questions and then letting them do it, and using that teach back method as well is really helpful. In other situations, the student might have an intermediate level. So here, this is times when they're starting to understand the routines that are happening, but they still need some, help with prioritizing and making decisions. So that might be, they're now assigned to a couple of different clients in acute care, or, they're trying to navigate, in long-term care, managing medications with providing personal care. So again, they still might need your help identifying how to prioritize and make some of those decisions when things become a priority. And then you might have, in some situations, the students, as they move towards the end of preceptorship, or maybe if they've had, some really strong clinical settings previously, they might be coming to you at an advanced level with some skills or some parts of their scope. So again, they're ready to take responsibility, and they want to refine and, be treated like a team member as well. So as they're getting towards the end of their preceptorship, you should be seeing more and more of this. You want to be able to give the students enough autonomy and leadership opportunities, but remember that you're still evaluating their performance. And again, I don't mean that in a punitive manner. It just means that you treat the student, you're able to, treat them as a colleague, but you're still able to give them constructive feedback and let them, take the lead on different aspects of care that's happening in the day-to-day care for your clients and patients. I'll also encourage you to think and be mindful of the different learner preferences that students have. There's, so much, knowledge and information out there about the different types of learners and how people absorb information the best. So some of the things that you can do if you have a student with you is certainly ask questions and observe what you're, observe what they're doing. So start by asking, do they prefer, hands-on practice, visual aids, verbal instructions, or written material? And that's a great way to get started. Like, how do you learn best? Just an easy question like that with students. You could also watch how the student responds to different teaching moments that come up as well. So again, are they, extra excited when there's a hands-on skill to happen, or are they, taking notes and writing down lots of detailed instructions for themselves? That'll clue you in as well to what type of learner they are. From there, you'll be able to adapt your approach and tailor your teaching to match their preferences. So a student who prefers, visual aids, maybe if, they've said they haven't, inserted a urinary catheter before, and they want to review that before they, it's scheduled for a client to have a change of their catheter. Well, they might need to log in and watch, a Mosby's video as an example of that skill before they go to do it. That's going to support them in their learning. So again, that's, allowing them space to go watch that and be prepared will certainly help create a safer learning environment for them. There's also, you want to have open communication. And one thing that, I've learned time and time again, I guess, as an educator, is avoid making any assumptions. Sometimes, I've thought one thing, but when I've always kept an open mind and asked the students about that, like, tell me more about that. And, again, when I hear their side of the story, I realize that, maybe I had some, underlying biases or, assumptions that weren't really valid. So just checking in on yourself regularly and making sure that you're thinking about how you're interpreting, I guess, what you're hearing from the students. I'll also we want to encourage students to be self-advocates. So the more you can empower them to express what works best for them, this will help build their confidence and help them develop strategies for lifelong learning and professional growth. So some different signs, that you might also want to look for. So, when you have a student, would be checking to see if you notice signs that the student is becoming overwhelmed at times. So some students may not verbalize some of their needs, but yeah, you might notice that, if they do have a neurodiverse diagnosis, you might notice things like that they're withdrawn, or that they have difficulty following some of your verbal instructions at time when things get really busy. We do offer accommodations in our practical nursing education. So again, sometimes students have extra time or a quiet space in order to be able to complete the skills that are required. And they're able to do those safely in those environments. So sometimes with very small changes to the work environment, you're able to support students be successful as well until things get into more of a routine nature for them. So again, different ways that you can support neurodiverse learners would be aware, if the student, discloses to you that they have ADHD, dyslexia, or sensory sensitivity, they might ask for clearer directions at some times. They might, want to make sure that there's different structure or a checklist. So different visual things that you can provide to them so that they can prep themselves. Lots of times students might need, the checklists are really a good thing, or some kind of work list. Stuff like that is very helpful for helping to stay organized. Next, as well, they might benefit from a quiet space. So again, perhaps the med room could be used, more frequently. For instance, in some situations, when if the unit is very busy. I'll just take a moment to pause there. There's a lot of information, I guess, in the last couple of slides. If anyone would like to write any questions in the chat or anything like that, please feel free to do so.
If anyone has any questions too, they can raise their hand if they find it easier than typing, and I can just keep an eye out for you, Cheryl.
Okay, perfect. The other really thing that we want to talk about with you folks is the importance of student performance and evaluation. So again, we want you to be able to recognize your students' strengths. So again, you're looking for initiative, professionalism, communication, empathy, safe clinical practice, all of those really great things. And if you see them, we want you to acknowledge them as quickly as possible, because the students will grow further based on positive recognition. So that's really important to boost their confidence. We also want you to correct unprofessional behaviors. So if you're noticing lateness, inappropriate language, poor hygiene, lack of accountability, or a dismissive attitude, those are certainly things that, we would like you to address with the student. And we can certainly help you with that. So there's a clinical instructor attached to every course, and they can help you talk through those things if you're, not sure how to approach it, or talk with your colleagues. And as long as you keep the conversation professional, maybe there's another person that's been a preceptor before and might have some ideas for you on how to approach that. I will go through a method that you can use. It's called the DESO method, and I have it on the next slide actually, but it talks about describe, express, specify, and outcome. So I'll go through a little example with you now in a second. Next, we want you to, and I already kind of mentioned this, but recognize your own assumptions and biases. So sometimes personal biases can unintentionally affect how you interpret a student's performance. So again, sometimes you might notice that, and how they communicate, or it might be somebody might be a different culture than yourself, or again, a student might have a neurodiverse diagnosis as well. So there's a variety of reasons why things happen, or how communication can change sometimes. So again, just think about your own any assumptions or biases that you think that you might be making, and recognize those. And then, this is really helpful so that if you are giving student feedback based on what you're noticing, make sure that you're focusing on the observed behavior and outcome, and not on the personality trait or the background of the student. Okay, so that would be a more, more important approach to take. Next, I'm going to make, we want to make sure that the evaluations are completed as part of their performance. So with the practical nursing preceptorship, there is a midterm and a final evaluation that would be written documents that we would need to have kept as part of the student record. So just, again, make sure that you're writing things that are specific, measurable, and avoid generic terms or phrases such as, has a good attitude or needs improvements. Try and stick with things like that are linked more back to your clinical proficiency and things like that. So again, you could say demonstrated safe medication and administration with minimal prompting, or bring, lots of times when we go to the first clinical with our students, we'll comment on whether or not they bring all the required supplies into their room in order to prepare for their first bed bath, as an example. So again, just making sure that we're keeping good notes about how the student is progressing based on the course. And then finally, we certainly want to make sure that you have supports and that you can reach out to the course leader or reach out to your manager when things need to be escalated. So if you feel that, at any point a client is, there's safety risk to your client, we want you to intervene. We want you to step in. But those are things that you should report to the clinical course lead and also to the manager. So anytime there's any unsafe practice, anytime there's unprofessional behaviors that might be affecting a patient's care or the team dynamics, if there's a lack of progress, the student is not progressing, after from each set of shifts, then we want you to reach out as well, because as a college and as educators in the practical nursing program, we do have ways to implement like a formal learning plan, and that would list out different strategies that we want the student to work on. Different course material that we want them to review, might be videos, might be coming back into the school and repeating a lab with an instructor. All of those things are possible so that we can make sure that the student is able to continue to progress during their clinical placement and be safe and again proceed through to graduation. I think that is it for that slide. I'm just mindful of the time here now. So this is the DESO method. So I'll just read through this for you for a second. We've just got a couple of slides left here today. So again, if in order to describe a situation, if you were to role play this and talk with a student as an example that had arrived late. So I noticed you arrived after the shift had already started and the handover report was nearly finished. I'm concerned because missing that report means you might not have all the critical information you need to safely care for your patients today. It's important that you arrive early so you can hear the full report and be fully prepared for your responsibilities. And then finish off with saying, being present for handover report helps you stay informed, builds trust with the team, and ensures safe, competent patient care. Let's work together to make sure you're set up for success each shift. So you can see how those 4 statements can help, describe the situation, express your feelings or concern, specify what you need or expect, and then outline the outcome that you want to see moving forward. So just in summary, your role as a preceptor certainly is to, help and identify the student's learning goals, supervise until you observe proficiency for your student, provide ongoing feedback and evaluation, and keep accurate and complete records, whether that's the evaluations or that's notes that you keep along the way to show, and keep track of things of how the student is progressing. So that brings us to the end of our presentation today for you. We certainly hope, again, with the various programs that we offer across the province, we hope that there is a student that's interested in a preceptorship near you, and certainly talk to your managers and see if there's a preceptor opportunity, because we would love to have more preceptors as we move into our winter semester. We'll be looking for lots. So thank you, folks.
Cheryl. And thank you. I was so excited to see so many people online today listen to our presentation. So I strongly reiterate what Cheryl says. Seek out as many opportunities to be a preceptor, speak to your managers. If you have questions afterwards, you can certainly reach out to me. I'm sure Cheryl feels the same way. If you have questions, we would be more than glad to answer them.